Welcome back to Sleep Better TV. My guests are Dr. Mark Levy and his wife Cynthia. They're sleep consultants and the founders of Dental Sleep Today. Welcome to you both. Now, when did you begin training dentists in the treatment of sleep apnea?
We started about 2 or 3 years ago, going into people's offices and training. So we've been doing it now, I think it's going on our 3rd year.
So as sleep consultants, what makes you different?
I think what makes us different is that we go into your office. We come into the dentist's office and we train everyone. We get everyone involved.
As far as we know, there's no other service that comes into the office with the doc and with the administrative experience that will come in and actually do it in your office, in your facility. By coming to you, it obviously saves travel expense, days out of the office. But better than that, we're treating patients on the 2nd day of our consult. We're treating patients in your office, and we run you through from the beginning of paperwork, all the way through the consult, all the way through treatment. We actually end up hoping that there will be 4 or 5 patients that we can treat on that 2nd day. And the nice thing is most offices end up making money by us coming to them on that weekend.
When a dentist starts treating sleep breathing disorders, I'm sure they're going to be wondering where they're going to be finding patients. Can you talk about that?
Patients coming in for treatment of obstructive sleep apnea can come from 2 ways, 2 general ways. One is your own patient base. When you're doing oral exams, you can look in a patient's mouth and you know what's going on once you're educating this and you know the clinical signs to look for. So your own patient base. And secondly, external marketing. CPAP failure is an enormous issue in this country. And there are a lot of people walking around. I talk to people every single day who were treated or diagnosed 3 years ago, tried a CPAP for a month, haven't gone anywhere else. So if you know how to market externally and you choose the proper marketing and your website is enhanced for it and you might experiment with radio, print, it can bring a flood of patients to the office.
An additional source of patients is our sleep physicians, sleep docs, pulmonologists, sleep clinics. Now they're not going to turn their patient over to you completely, but if they're not getting anywhere with the CPAP, they'd be thrilled to have their patients treated with an oral appliance because then they are able to maintain that patient as a patient. They just want to keep them in-house eventually.
So there really are many ways that patients can come to you.
And what's the return on investment?
I do think that there's a very good return on your investment because we do treat actual patients and we do allow you to have some revenue coming in to actually cover the cost of the consult. So I think it's really important because we get everyone in the office involved and everyone motivated about this. We teach them what it is. I think having been with Mark this long, working with him, I've seen him go take a lot of continuing education courses, come back, and there are no protocols or systems to implement it, and nothing happens.
Staff is not motivated at all.
And so that's what we try to do. We try to bring it to your office and make sure that everyone's involved and that protocols are in place when we leave so that you can actually start seeing patients immediately and successfully treating them, and most importantly, actually getting paid for your services.
My guests have been Dr. Mark Levy and his wife Cynthia. They're sleep consultants and the founders of Dental Sleep Today, and you're watching Sleep Better TV.